results in frozen shoulder. What is the root cause? Maybe the patient has a past history of the problem. Perhaps patient has no past history. Maybe it's happening for the first time. So it's important for you to talk to the patient to see if there is a past history of a problem. If not, it is mandatory that you call for investigations. You order for investigations. Blood test, a urine test, an X-ray if you must, in order to rule out the possibilities. So just before you start using Stomach 38, you will tell the patient, look, I'm going to use an acupuncture point which will release the pain and restore the mobility instantaneously. But if you don't come back to me with the following investigations, the root cause will not be addressed and the pain can be subjected to immediately once again sometimes. Yeah? So it's important that you inform the patient what the root cause would be. So this is why it is important to enter into a conversation, yes, which will allow you to apprehend and narrow down the possibilities of investigations. If not, you will have to call for all investigations from A to Z. As I told you, it could be possibly a spondylosis, cervical spondylosis, where the patient would have been subjected to a whiplash injury. There could be a problem with the cervical rib as well. As I told you, it could be a problem with the apex of the lung, problem with his heart, ischemic heart disease, increased cholesterol, increased sugar. Whichever the case may be, the body's only way to express the problem which is deep-seated, if not deep-rooted, is in the form of frozen shoulder. So do not negate or neglect what the body is making an attempt to tell you. Use the Stomach 38 after educating to the patient that, look, these are the possible problems that you are subjected to, hence I want you to come back to me with the investigations. Right. You also can simultaneously check the auricle. With the auricular diagnosis, you could re-endorse the possible problems which you have already identified as possibilities. Okay? So that is one example of pain manifesting as a protective mechanism, a protection attempt so that the problem will not become more detrimental. Number one. Another example, sporting injury. Talk about sporting injury. Let's take an example. The World Cup, the finals, where the French captain Zidane possibly can be a decision maker. Zidane is a man who can win the match for France single-handedly. So what will the opponents do? They'll try to injure him to an extent where he can be eliminated from the game. Right? So he starts playing, goes on playing, right? And then somebody gives him a leg break where he injures his ankle. Just an example. Or it could be Maradona, it could be anyone who's the man who can win the match. It could be any sport. He gets an ankle injury, hypothetically. Now what does the injury tell him? Oh, the pain would indicate to him the range within which he can comfortably move. Yes, and that's your ankle which has an injury. When he starts moving, at one point it starts aching. Ouch, there's pain. The other way it starts moving, oh, there's pain. Right. Good. Now what really happens? The pain tells the range or the periphery within which you could comfortably, without causing aggravation, move your limbs. But what will the physio do? He has to be in the front line. Without him, they are going to lose the match, for sure, for certain. So the physio would give anesthetic injections, anesthetic cream application to kill the pain. The moment that is done, even though the problem is there, the tendon, ruptured tendon, let's say, he should be able to move his limbs or the joint without feeling the pain. Why? Because with the anesthetic application or the painkiller, you negated the signals given by pain. Movement is back to normal. He goes back to the front line, wins the cup, alright? Brings fame as a patriotic citizen of the country, hailed as hero, a legend of the country. But what happens when the effect of the painkiller subsides? He has caused aggravation to the problem. The problem when it happened, if he had been treated at that point onwards, perhaps they would have cured him. But with the painkiller, he has gone beyond, causing more aggravation, more injury, which could be irreversible after the game. Yes. So pain is a protective mechanism in this context. And what is the formula we use in a sporting injury? When there is an injury of this nature, it's an abbreviation called RICE. R-I-C-E. Abbreviation called RICE. Now what does R stand for? Rest. Rest. The gospel is to rest the patient. What were the injuries? I stands for ice. Ice. Now homeopathically it is heat. You keep hot water fermentation. I stands for ice based on allopathic approach. C stands for compression. Compression. Yes. And E stands for elevation. This is your formula for any sporting injuries. Right. Rest, ice, compression and elevation are the formula for sporting injuries. Okay. Now this is how a pain manifests in the form of a protective mechanism on one side. The other side, it's a mystery or a puzzle. Why do we say this? It's because there are instances where pain can be very much out of proportion to the problem by itself. The problem can be minuscule, but the pain is far in excess. Or a puzzle. Take the case of simple toothache. Toothache. It is not a matter of life and death situation. It is not a life and death situation. Yet the pain is far more intense and excruciating than the problem by itself. Toothache is not a major problem as such. You've been subjected to toothaches number of times, extracted. But the problem is not a matter of life and death situation. Migraine or migraine. We just spoke about migraine. We had 2 patients. Yes, that's very funny too. The pain is so intense, people kill themselves. It is suicidal. But why is the pain so intense? GOK. What is GOK? God only knows. Yes. The pain is so intense. You take away pain, there is no disease called migraine. Take away pain, there is no disease called migraine. Pain itself is a disease here. The trigeminal neuralgia. Trigeminal neuralgia. The 5th cranial nerve. Yes. Which has 3 branches. I think we had a patient a couple of days ago as well. The 3 branches are the ophthalmic branch, the mandible branch, and the maxilla branch. 3 branches. Now how do you denote the areas? To keep the center of your palm at the eye. Now that is the region which the ophthalmic branch would innervate. That's the ophthalmic branch. Now you keep the base of your palm at the base of your chin and the middle finger at the base of your earlobe. Now that is your mandible region, or the branch which stimulates or innervates the mandible region. Now once again, that's your ophthalmic, now this is your mandible. But the region which is not covered here is the maxillary region, the 3rd branch. Now depending on the branch which gets inflamed, the pain can be excruciating. If the ophthalmic branch is inflamed, the patient will have excruciating pain on the ophthalmic region. If it's the mandible branch, the patient will have pain on the mandible region. If it is the maxillary region, the maxillary branch. 3 different regions which can be excruciatingly painful depending on the branch which takes the branch. So the pain is so intense in comparison or in relation to the problem by itself. There are methods where they operate or give alcohol injection. But what happens? The pain is a mystery again. It bypasses the nerve and then the pain can recur with more vengeance. But we have been very successful with acupuncture where trigeminal neuralgia or migraine or anything to do with pain can be controlled and cured. Yes. Phantom limb pain, where soldiers